Hello, I'm Penelope Roskell. I'm a pianist and professor of piano and piano pedagogy at Trinity Laban Conservatoire in London. I'm the author of The Complete Pianist from Healthy Technique to Natural Artistry, and I'm also a specialist in pianists' injuries, and I work in a multi-disciplinary clinic for the British Association of Performing Arts Medicine in London. In this presentation, I'm going to share with you some of my experiences of working with injured musicians. I'll talk about ways in which teachers can support their students during this period, and I'll demonstrate some of the exercises I use to help them in the recovery, which are also useful preventative exercises. These exercises can be used for pianists of all levels, and although I'm a classical pianist myself and most of my students are classical, they can be used to help pianists working in any genre. Sadly, injuries are still very prevalent amongst musicians and particularly amongst pianists. These are some of the most common playing-related injuries that we see in the clinic. The most common playing-related injuries are tendinopathies. These are the type of tendon injuries which used to be known as RSI or repetitive strain injury, or sometimes as overuse or misuse conditions. They may cause pain, numbness, or lack of power in the hand or wrist. Examples of tendinopathy are carpal tunnel syndrome, de Quervain's disease, trigger finger, tennis elbow, and golfer's elbow. Technical retraining will involve finding ways to rebalance muscles and to avoid putting excessive strain on these particular tendons in the future. Shoulder and neck pain is often related to posture at the instrument and can also negatively affect the arms and the hands. We also see a lot of pianists with arthritis. This may not be specifically playing related, but they may need advice on technical workarounds which will help them enjoy playing well into the future. These workarounds will focus mainly on softening the impact of the hand on the keys and perhaps learning to cope with a reduced span or a changed hand shape. We also regularly see pianists with focal dystonia, which, as you may know, is a very distressing condition involving involuntary movement of the fingers. We find that technical retraining can bring about significant improvement in pianists with focal dystonia. There's more information about specific conditions on my website, healthypianoplaying.co.uk, with a list of symptoms, possible treatments, and some recommended technical modifications. If a student says that they're experiencing pain, they should be advised to stop playing completely or to reduce the playing to the level where they're no longer experiencing pain. If they have inflammation, a doctor will probably recommend a rest for a few days, perhaps using a splint or a bandage to prevent more movement, perhaps some ice, and perhaps some anti-inflammatories. A few days rest may be all that's needed. But if the pain continues, or if they experience swelling, weakness, numbness, restriction of movement, lack of control, or involuntary movements for more than a few days, then they really need to seek specialist help and get a proper diagnosis. The doctor ideally would be somebody who specializes in hand or upper limb disorders. And he'd be able to refer you for tests. He might be able to refer you for some hand therapy, that's a specialist form of physiotherapy, or other types of physical therapy such as Alexander technique or osteopathy or physiotherapy. Ideally, the exercises given should not be too strenuous because we should take into consideration that a pianist's hands can feel very sensitive at this time. The doctor should also be able to talk through the advantages and disadvantages with you of any medical treatments and their possible side effects. A formal diagnosis and a doctor's report may be necessary if a student needs to, for instance, defer studies or cancel an event. And the earlier the diagnosis, the quicker the treatment can start, the quicker you can start to modify their technique and try some technique retraining, and the better prognosis for a quick recovery. Sometimes a pianist injury might be quite subtle and it doesn't always show up on a diagnostic test. This is because pianists tend to be a little bit more sensitive than the average person. Things that anybody else might ignore ring alarm bells in a pianist because we might just notice that it impacts on our way of playing. And so, if you come across a doctor who says, no, the test results are negative, it's all in your mind, ask for a second opinion with somebody who understands the impact that this might be having on your playing. The Tubiana scale is a useful tool. It measures a student's ability to play from a scale from 0 to 5, with 0 being can't play at all and 5 being able to play at normal optimal level. And it's a very useful way to be able to track your progress as you recover. It's very normal for a pianist to want to play at an event that they've been working towards for a long time, and they may be tempted to work through the pain. But the old adage, no pain, no gain, is totally wrong. It's not worth sacrificing one's long-term health for just one particular event, and students should be encouraged to defer if they possibly can. Injuries may take time to heal. There's not a big blood supply coming through to the hand, and it can be very difficult to predict just how long it's going to take to recover. An injury can be very distressing, especially for a serious musician. They may be worried about their future career and about loss of income. Their self-worth may have been very bound up with their playing, and the sense of loss can be quite devastating, so they may need quite a lot of additional support at this time. If their low mood is actually concerning you, I don't think it's inappropriate to suggest that they look for some extra support at this time. Doctors used to recommend complete rest, but now they've slightly changed their views on it. Firstly, because scar tissue may form, which can actually start to reduce the movement for the future. And also, complete rest can cause frustration, low self-esteem, and even despair. I think all musicians need to feel that they're progressing artistically and technically. So I find it's very important to keep my students occupied during the time. And these are some of the tasks that I assign to them. Firstly, listening to recordings. This can be very inspirational and can give good ideas for future repertoire. Reading. I often recommend sections from my book, The Complete Pianist, as well as books by other writers. Teaching mental preparation skills. It's an ideal time to learn how to learn a new piece effectively, how to study a score, and to improve harmonic understanding and how to memorize away from the piano. These skills will all continue to come in very useful when they resume playing. We also discuss more healthy practice methods and the importance of warming up, and we plan new repertoire both for the recovery period and beyond. The recovery period allows busy musicians time to perhaps consider what may have triggered the problem in the first place, and time to reassess their technique. Possible triggers to look out for may be: was there a stressful deadline with a sudden increase in practice time? In that case, they may need to reconsider their practice regime and their practice methods and learn how to forward plan more effectively. Which pieces were being played when the pain first occurred? Which aspects of technique were particularly challenging? I also like to consider whether any non-musical activities could have exacerbated the problem, especially now that so many of us also spend large portions of time typing and texting. Also consider leisure activities such as gardening, crafts using a very repetitive action, or lifting heavy objects. They may need to adapt their technique for these activities as well. It's also worth making a note of any movements that cause pain at the moment that might need to be avoided for the time being. Sometimes the obvious short-term trigger may just be the straw that broke the camel's back. Many playing-related injuries are the end result of long-standing technical problems. The most common of these are poor posture, tension in the wrist, elbows or shoulders, unnatural hand positions, for instance a very high or very low wrist or collapsing joints, faulty alignment, I'll talk about that later, playing with high curved fingers, especially when this is combined with intense finger strengthening exercises or studies, exerting excessive pressure on the keys and continuing to exert that pressure after the tone has been produced, and playing repetition at a stretch over long periods, especially when playing forte. It's also worth being aware that hypermobile students, pianists with small hands, and teenagers going through growth spurts are more at risk of experiencing injuries. Also, if somebody's going through a period of emotional or mental stress, or perhaps with psychological problems such as perfectionism or anxiety, this can cause physical tension which might just overstrain an already sensitive body. The recovery time is the ideal time to make changes, to assess and modify the technique. However, with some students you may encounter some resistance. They've been using a certain technique for many years, it seems to have served them well, and they really don't see why they should have to make any changes. They may not even realize how tense they are until eventually they experience a different way of playing. I do find that the students who have most at stake, perhaps the young professionals, are the ones who have the most determination and the most patience to make the changes, and they are the ones who in the end are most likely to make a full recovery. This is an important time to start to review practice methods. Doctors recommend taking frequent breaks, in fact after every 20 minutes. This may seem impossible for most pianists. We've only just got into our practice by that stage. But we can achieve a lot during these breaks. For instance, we can switch hands to give the other hand a break. We can do some stretches. We can study the details of the score, looking at the structure, the harmonies, checking out the rhythms and all the details of phrasing and shaping. We can do some inner listening or some memorizing away from the instrument. It's important to vary technique during practice. Alternate fast and slow passages and left and right hand practice. Avoid practicing forte unnecessarily. If working on the initial stages of note learning, rhythm or fingering, just play at a piano dynamic. Avoid a lot of mindless practice and instead increase awareness of movement and of the sound. Practice smart, not hard. This is the ideal time to start to discuss some of the principles of healthy piano technique. Firstly, the importance of using muscles in a balanced way. Then also using the minimum amount of effort for the maximum musical result, and avoiding tension by increasing suppleness and flow. I'm now going to show you some of the exercises that I find are safe to use for students who are recovering from injury. You may like to try them out with me. The first few involve some arm swinging, which require a little bit more space, and then the rest can be done just sitting at your instrument. This warm-up sequence brings an increased blood supply to the hands and fingers, which can help the healing process. It also releases tension in the neck and in the shoulders and down the arms, so it puts the body into an ideal state from which to start practice. I use it regularly before I practice, as do many of my students, not only the ones who have experienced injury. Once you've learnt it, it takes about 5 minutes, and it can easily be adapted for students with very stiff shoulders. You can just make smaller movements. We start with the exercise called the swing, and in this we just start with very relaxed arms. You can shake them a little bit to check that they're relaxed, and then let them swing backwards and forwards. You can use the image of the pendulum or the ropes of a child's swing to get a very effortless swing. And this really starts to loosen up the muscles around the shoulder area. If your shoulders feel comfortable, you can let the swing really fly, and this engages and releases the muscles of the back, and even the legs get involved in the movement. But it can also be done at a much lower level if your shoulders are very stiff. The next exercise is called empty sleeves, and we imagine that our arms are so floppy they really don't exist, we just have empty sleeves. And as we twist our body from one side to the next, our arms start to just float around in response to the movement. The head goes with the movement. So we just do a few of these, let the arms just fly around. And if you have any problems with your knees, keep your feet soft on the floor, lift the foot that's not taking the weight, anything to just keep the knees nice and soft. And you can do that as many times as you like, and then just let your arms come back down to rest again. The third exercise is called the monkey, and for this I start leaning forward slightly in this way, so that I can just get the feeling of swinging my arms from one side to the other. I put my weight on the right and on the left to help the swing establish itself, again keeping my arms very, very loose. Once I get it going, I stand up and just let my arms fly from side to side. This gives a lovely stretch across the body in a diagonal way. And just do that for as long as you want. And even after doing those 3 exercises, you will have released some tension from the shoulders, and you may even already feel that there's a little bit of tingling in the fingers, which indicates that more blood has been able to come through to the hands. Next, we put our hands on our shoulders, and we're just going to do some shoulder rolls. So we're going to draw a circle with the elbow forwards and then back. And we'll do quite a few of those. Do them with your breath, so breathe in and breathe out. Feel that your arms are lightly just rising up as you breathe in and just floating back. So it's a very smooth movement and there's no tension in the neck. And then come to a halt but when you're just about to go down, and just let the arms float back down to your side. And you'll notice that the chest feels a little bit more open. Now you can just do a few shoulder shrugs. So just lift your shoulders a little bit, not so much that the neck tenses up, and just let them sink down as you breathe out. Do it several times and really feeling that your shoulders are dropping further with each shrug. Do it about 5 times. Now there's a very strange part to this sequence. Some people don't get it immediately, others get the benefit of it immediately and really enjoy doing it. You imagine that there's a tap on the top of your head, and this tap is attached to some rubber tubes which goes down through your head, through your neck, through your shoulders, into your fingertips. And so you're going to imagine that somebody turns on the tap and the water swishes down your arms into your fingertips. And in order to get that sensation, it helps to close your eyes and even also to make the sound of the water swishing as you do it. So I take a breath in and just swish. Again. And I try to feel the heaviness of the water in the fingertips at the end of each breath. You do it in time with your own breathing. And you do that about 5 times. Then what can really help to align the arm correctly is to just feel that you're swishing that water into the fourth and fifth finger in particular. And you can also imagine, if you want, that you've got little holes in the ends of your finger, and the water is not only swishing into your finger, it's actually really swishing out and dripping down onto the floor. I know it sounds a bit strange, but it really does work. So again, you just take in a breath, and imagine the water dripping down onto the floor. And again, you can do that 2 or 3 times. Now, a lot of people find that that's very relaxing, and so in order to liven me up again, what I do is to just do a little sort of mini jog, which really softens up the legs before I start practicing. So I just switch from one foot to the other, moving the weight from one to the other, and as I'm doing it, I'm just coming up onto my toes and then going back onto my heels and up onto my toe, and so on. So I'm switching the weight very softly from one foot to the other. And then I'm starting to come up a little bit more, make it a little bit more lively, so that it becomes a very soft mini jog. And you see how that not only it softens the feet and the ankles and the knees and the hips, it also has more effect on the shoulders again and on the arms, so they become even more floppy. So by the time you finish this, your heartbeat has risen a little bit, and you're a little bit enlivened but very relaxed physically, so you're ready to start your practice session. Postural imbalance can exacerbate any problems. For instance, if the neck is tight and the shoulders are hunched in this way, it can affect the function of the arms. It can also affect our breathing, which can cause more anxiety. So it's worth looking at our students and observing the way they're sitting. I'm going to talk about 3 aspects of sitting today. Firstly, just about stool height and where we sit on the stool. Commonly it's taught that the arm should be at a 90-degree angle here. I find that restricts the movement across the body, and it also means that the elbow is a bit tight. It means you can't get enough engagement of the stronger muscles in the upper arm and in the shoulder area. But what I do is I start from a position where the forearm is pretty much parallel with the floor, and then I push the stool just a few inches back, and you see that just softens the angle here, and it means I can move freely right across the body. And it does mean that for me the forearm is sloping slightly downwards towards the hand. I find that works well for me because it means that the weight actually goes into the fingertips rather than into the elbow if you've got a rather low elbow. Then if we just think for a minute about the shoulders and the neck, a very common problem is this, where the neck is tight and the head is being pushed forwards. So what we want to do there is to encourage them to just tuck the chin in. So if you do this a few times, that exercise, so they get the idea of the difference in that way. And then they can be nicely aligned with the head resting on top of the spine. The third thing to think about is the position on the seat. We want to be a little bit on the edge of the stool, not right in the middle of it. I find being on the edge just gives you a little bit more flexibility of movement around the keyboard. And of course the feet should be firmly positioned on the floor. If it's a child, you want the feet to be supported. Now, another thing that you see very frequently is slouching in this way. And you see how if I do that, my shoulders are brought in and they're a bit rounded and hunched. So if we can support the lower back more and reposition the pelvis, then it actually solves the problem of the shoulders. So I have an exercise that I do for this. which I use for adults. If you're talking somebody who's a child, for instance, you could just tell them to sit up tall and really stretch up into the sky, and then keep the length of the spine, and then just let the arms come back down to the side. So that already produces a much better posture. Another way you could do this is by putting your hands underneath your seat, and you'll feel the two bones, which are the sitting bones, which are the bottom of the pelvis. And what's really important is that the pelvis is positioned at the right angle. Now, if we're slouching, what happens is it feels those bones are pointing forwards. And if, on the other hand, we're overly arching the back, the bones are pointing quite far backwards. And the ideal position of the pelvis is one in which the bones point very slightly backwards. So I get myself into position in that way, take my hands away, and immediately my whole spine is erect without making any muscular effort. The problem is, if we don't position the pelvis correctly, what happens is the pelvis sags down in that way. And then if we try and sit up straight, we have to use a lot of muscular effort, and then that puts a lot of tension not only in the shoulder area and the spine, but also in the arms. Now, once we've got a comfortable sitting position, we want to think about how we'll bring the arms to the keyboard. And if you think about how you are naturally sitting, your arm will be in a position where your thumb is facing forwards rather than the back of the hand, for most people anyway. So what we want to do is to bring the back of the hand towards the keyboard to go into playing position. So what most people do is they bend at the elbow and then rotate the forearm. And that already produces quite a lot of tension in the elbow and in the forearm. So what we want to do is do an exercise which actually helps to rotate the arm in a very natural way to bring it to the keyboard. So we're very comfortably in playing position. Because nobody wants to be in a position where they've got their elbows in tight. That encourages the shoulders to come up and the hands feel very uncomfortable. We want the arm to feel loose and flowing. So I have an exercise that I call the swan landing. I use the image of a swan because a swan is a very powerful bird that uses its wings from the center of its back. So in this, we start with palms upwards and just opening out the hands in this way. So you see what happens here is it opens out the chest. And then I turn my palms down and come back. So I do this as a figure of 8 exercise in this way. Now, what this is doing is exercising the very powerful muscles in the shoulder and back area which hold the arms up. So when you come back to playing position, you'll feel that the arms feel quite light because you've started to engage those stronger muscles to hold the arm up. And you'll see how the arm feels comfortable. It's in a nicely rounded position with not a stream angle. It's not pulled in. The shoulders are relaxed. The elbows are relaxed. Now, of course, we can't do that exercise if we're just about to play in public. So a very simple way of achieving a very similar result is by imagining that you've got a string attached to your 5th finger, the knuckle of your 5th finger, and that this is being lifted up and your hands are just placed into playing position. It's much better to feel that you're lifting from your 5th finger, and you see how the arm is very rounded then. If I lift from my thumb, again, I get into that slightly twisted position. I'm now going to show you an exercise that I call the parachute touch. I use this exercise for all my students, not just those who've experienced injury, because it teaches so many useful aspects of piano playing. It teaches how to use gravity rather than pressing into the keys. And it also teaches how to keep the wrist and the elbow very, very soft and the whole arm well coordinated. I start by teaching a very broad movement which is away from the piano. And I talk initially about the arm as being a hot air balloon, and we imagine that the hot air balloon just floats up into the sky. And notice how this part of the arm, the upper arm, also moves with the movement. And that once I've raised the arm, my wrist is very relaxed, so my hand just hangs very loosely. Then you imagine that the hand turns into a parachute and that the cool air just supports the hand as it comes back down like a parachute. And we can do this with both arms and start to get it into a really flowing motion, but in a very broad way. I find students find that if they learn a movement in a broad flowing way first, then they find it very easy to minimize it just to the tiny movement that we need at the piano. So we start to minimize this to the point where it's a bit like being in the ocean and your arms are just floating on the waves. So the tiny up and down movement. And then we can start to use this, and I drop onto just one note. And you can see how the wrist is very soft. The elbow is also very soft, and the whole arm is well coordinated. Then I start to move around, perhaps on a scale. And we might start to use it in thirds or in chords. Now, things you need to look out for there are what a lot of students do is they start to play the chord, they reach the key surface, and then they push. You see what they did? They hesitated on the key surface and then pressed. So they're not using gravity at all, they're using pressure, and this can really build up the co-contraction tension in the forearm. So I liken this to landing on snow. You can imagine a parachutist coming down and lands on the snow surface. They're not then going to push through the snow, they're just going to sink through the snow. And so similarly, we just sink through the resistance of the keys and land on the key bed in that way. Now, the other thing you will probably see happening is the wrist, if it's very relaxed, it may drop down too far in this way. It'll do that. Okay. Don't worry if it does that initially, because you can always suggest that they re-inflate it, they just let it float up again. So what you can just do is encourage them to just practice letting it float up, and then eventually it minimizes to the point where they start by doing this, and then eventually. So there is a tiny bit of give in this way as I play the chord, and immediately afterwards the arm is light and the wrist is very, very relaxed. Now, what I then do is start to add in some extra notes. So I'll start with just C and B. So I just land on the C, transfer the weight to the B. Using third and second finger. Right. Now, then I can add in another note, 4, 3, 2. So they're learning to use arm weight to drop with gravity onto the beginning of a phrase or of a scale. And then they can add in more notes. Starting to add in more notes. Then they can add into the sixth. And so on. So they can feel how much freedom they get from playing the first note, the beginning of the phrase, with a very soft wrist, a soft elbow, and a well-coordinated arm. This can lead on to playing this in pieces of music. And Each beginning of the phrase could be played with a parachute touch. We can also use the parachute touch to use gravity in different ways to create different dynamics. And I have a little story that I use with my students here. I call it the 4 parachutists. And you imagine that the first parachutist comes out of the helicopter and he has the choice of the best parachute, so he comes down really smoothly and slowly and produces a piano sound. The second has not such a good parachute, it's got a few holes in it, it's a bit old, and they'll come down a little bit more quickly, so a landing with a more firm sound. The third has a really small parachute and will come down more quickly. And the poor fourth one, we don't even discuss what happens to that parachutist. So they can start to use this on any chordal passage as well, which needs different dynamics. So for instance, the Rachmaninoff prelude, you can start with a free fall. And then use different amount of arm weight. So you see how I'm varying the amount of arm weight I'm dipping into each note. Now, a big cause of pianist injuries is the tendency for most pianists to continue pressing into the note once they've actually finished producing the sound, and of course that's not going to make any difference to the quality of sound whatsoever. So we need to learn to take away the pressure once we've actually played the note or the chord. And again, this is what the parachute does, because we use gravity and then we just take away all the pressure and the arm is very light and floating. So we can use that to produce a staccato as well, where we drop down and then float off. And this is quite different from the sort of way a lot of people play staccato, where they think they've got to snatch the hand away from the note to make the staccato as short as possible, and then that causes a lot of tension in the forearm. So we can do a short staccato where we're just bouncing straight out. We're using the rebound of the impact of the hand on the key, just immediately produces a natural rebound, so it's completely effortless. We're using gravity to come down and the rebound to come back up. It's important for all pianists to learn how to avoid and minimize stretches when they're not necessary, and especially for any pianist with small hands or with thumb or fifth finger problems, because none of us want to be spending long periods of time with the fingers stretched out to their maximum stretch. The hand does not function well, the wrist tends to tighten up. So the first thing I do is talk about how we open up the hand, and I don't use the word stretch, I use the word opening the hand like a fan. So instead of thinking about stretching across the knuckles, and you can see how my hand looks quite tight, my wrist is very tight, I think about opening across the palm of the hand and doing it in a very gracious way. I talk about offering a gift, and this feels so much more comfortable than stretching across the knuckles. So we open from across here, we check that the wrist is really loose, come back and put the hand on the keys. Now we all need to find places where we can reduce the stretch whenever we can. And a very good example of this is the first Chopin Etude, Opus 10, number 1. It's written as if we have to be at the stretch of a tenth all the time. Some people can play like that if they've got very, very large hands, but most can't. So we don't want to keep the hand out at a stretch this way. You see, that's really tough on my hand. So what I'm doing is I'm thinking note by note. So I play the first C, and at that point my hand is not stretched out. I then play the G, and that is not a big stretch. I let go of the stretch and my hand goes back into its neutral position. I play the fourth, I play the fifth, and my thumb is already in position. So at no point in that am I at the full stretch. My thumb is played and my fingers are there. I open out a little bit and there and back. So my hand is never at a full stretch. Another example is the Opus 25 number 1, where I often see students and they immediately open out their hand to full stretch before they even start to play it. And again, in the right hand, I'm starting by just playing the fifth finger. I'm going to play that with a parachute. And then I'm just going to bring my hand into position for the second and the fourth and the thumb. So what is happening here is my wrist is doing an elliptical movement which takes each finger into position. And the wonderful thing that happens here is as you do that, my forearm is in line with the fifth finger as I play the first note. Then as I come round, it's in line with the second and fourth, then it's in line with the thumb, then the second and fourth, and then back in line with the fifth. And as each finger plays much more effectively if it's got the support of the arm behind it, in this way also each finger feels more comfortable, more relaxed, and it feels that it's got a lot more support from the arm, as the arm is always aligned behind the playing finger. With all my students, I find I have to teach them techniques for playing wider chords and octaves without getting too strained in the hands. Even pianists with larger hands, but especially for pianists with smaller hands. And the first thing we need to do is to show them how to play an octave without tightening the wrist. And a pianist, for instance, who's really had any pain would probably need to avoid octaves at all initially. So we might even start by just playing at the interval of a fifth or a sixth. So we'll play the interval and then just check how the wrist is. See if it stays really relaxed. When they can do that, you can start to encourage them to play at the octave interval of a seventh. And then the octave, and see if they can still keep a very soft wrist. That can be very, very hard for somebody who's always played with a lot of tension in the wrist. Now, the other thing you can show them is that in between these chords, we don't need to keep the hand at its full stretch. So what we can do is play the octave, and then as we come up, let the hand relax into what I call its neutral position. So it opens out, it splays out as you play the octave, and then it comes back. And this is a very, very useful exercise for anybody who's had any hand problems. So let it relax, let it relax, let it relax. Now, like any exercise, when you do it initially, you'll probably exaggerate it, you'll do it very slowly, you'll bring the hand up high, and you'll get them to really feel that the hand is fully relaxed between them. And of course, when it goes faster, you won't be able to do such a big movement, but the hand will have been trained to just release that little bit of attention that's built up between the octaves. So you start with... So as it goes faster, an observer won't notice the tension being released. It won't notice the hand closing in a tiny bit, but it's there, and it avoids the octaves getting more and more tense over lengthy passages. So the splay technique is extremely useful for cantabile, chords and octaves. because again we're using gravity, we're softening the impact of the fall, and we're relaxing between the chords or the octaves. Now, when you're playing a staccato chord, another image that can be very, very helpful is the image of a jellyfish. I have a jellyfish exercise where I ask them to just mime in the air the movement of a jellyfish which is pulsating through the water. Now, you can see what happens with that movement. Automatically, the hand softens in between the more active moment of playing the chord. And this is a fantastically useful image for even beginners when they're learning, say, at an interval of the fifth. They're just then you can extend it and use it for a fifth and a sixth, and building up towards an octave. But you see how between each of those my hand was fully relaxed, and so there was no possibility of a real build-up of tension between some repeated chords. I find that students who struggle with playing octaves because they're painful may need to omit them for quite some time, even after they're nearly recovered. And so what we often just do is play the line with just the thumb or just with the fifth finger, so that they're getting used to the line in the piece, and then a few months' time, when they're fully recovered, they can put the full octave into that passage. I'd just like now to talk a little bit about elbows. Nearly every pianist I work with has tightness in the elbows. And I think this has come from our initial stages of learning the piano, where we were taught perhaps just to play with finger touch and not really extend to the outer reaches of the piano. And so the elbows got a bit used to being very static and being held quite close to the body. So I have an exercise that I call dusting the keys, or sometimes I call it elastic elbows. It's the same exercise. And what they're doing there is really opening out the elbow this way. So we're doing this. Maybe coming back over the black notes, white notes, black notes, and so on. And this really teaches them to keep the elbow very, very soft. And so before any passages that require leaps, for instance, I'll get them doing that exercise so they've loosened up that movement. Similarly, to move forward, say we're going on to the black notes, we've suddenly got to reach onto a black note chord, we need the flexibility of the elbow in this way. So that's a useful exercise to be doing as well, to open out the elbow in this way for whenever they want to move forwards on the keyboard. Or say when they want to do a more circular movement, those movements combine to have a beautifully expressive elliptical gesture which coordinates again the whole arm. Now, I do sometimes see students who come to me because they've had some injury as a result of doing passages that have a lot of rotation movement over a long period, for instance, like the Allegro in the Pathetique Sonata. And usually that means that they've been doing a very tight forearm rotation, often with a very tight elbow. So with those students, I always do a little bit of work on trying to loosen up their rotation. And I have an exercise that I call pastry dough. I tried to get them to imagine that their arm is as soft as bread dough or pastry dough. It's very, very floppy. And so I get them to just roll it around, move around on a book or on a cushion or on their legs. So they get the idea that the whole arm is very loose and floppy. And you see how my elbow is very loose and floppy, so even my upper arm is engaging in the movement a little bit, not consciously, but it's just because the elbow is soft, the upper arm is also free to move. And so I start from that, and I always take them back to the interval of a fifth. We don't immediately go back onto the interval of an octave, because that can cause some of the old problems to come back. So we start at an interval of a fifth, or an imaginary one, and just imagine that we're just going to tap the thumb at a small interval and just do this. And then we start to bring in the fifth, And we always come back to this resting position where the forearm is most at rest, the bones are parallel to each other, there's no twisting there, and then we come up, do a few more, and so on. And I actually find it's easier to teach a rather fast rotation but in very small stretches, so just a few notes, than to try and teach them to do it slowly, because then things start to seize up a little bit more. Then after that we just take it to the piano, and again we'll just start with a fifth, and again we'll start with resting on the fifth and just do a few taps on the thumb, and then start to bring in the fifth, and then when they feel really comfortable with that, start to extend it to the sixth, and then if they're really comfortable with that, extend to the seventh, and then gradually take it to the octave. But again, you want to really check that the elbow is very soft, and you don't want to be encouraging them to do the octave, or especially anything beyond the octave, until they can really feel that the whole arm feels very free and loose whenever they do a rotation. After that, you can go on to more complex things, using different fingers, different intervals and so on, adding in extra notes in the middle. But it's just really important for them to get a very, very loose, simple rotation, just at a small interval, before they try to go on to anything more complex. I usually teach these new techniques initially in the healthy hand, and then we transfer it into the injured hand at the appropriate time. We just do perhaps a few minutes a day initially, and then build up the length of time practiced. If a student's been experiencing a lot of pain, then they may need to do it with a very light touch initially, perhaps just shadowing the keys. I find it's also very useful to find some simple but musically enriching pieces to keep them inspired at this time. Pieces of the Baroque and Classical era may be ideal because they don't often use such wide stretches, but they do teach a lot about movement, about style, phrasing, structure, balance and beauty of sound. Once the pianist is ready to start playing again, they need to do it gradually and to stay below the pain threshold. Janice Horvath, in her book Playing Less Hurt, suggests a routine which can be very valuable. You start with just playing 5 minutes a day. Then, if that's tolerated, you play 5 minutes twice a day, then 3 times a day. And if that's okay, then you go to 10 minutes once a day, then 10 minutes twice a day, 3 times a day, and so on. You can end up doing 2 steps forward and then 1 step back, which can be very discouraging. So students need lots of encouragement, and it can help if you note any small improvements, make a note of the pieces and the skills that they have learned. Don't encourage them to play anything more challenging until they've learned a much more effortless technique. Injury may feel devastating at the time, but later, and with hindsight, many of my students report that not only did the work that we achieved help them prevent future relapses, but it was also important development for them as a musician. Healthy technique is also musical technique. It's good technique. If we play it in a less tense and impactful way, using more natural movements, it improves the tone quality and the natural flow of their musical performance. And a pianist will re-emerge with greater understanding, a well-coordinated technique, and with much greater musical freedom. The exercises I showed you earlier are not only remedial, they're also preventative. And I think that ultimately a teacher's role is try to prevent any injuries happening in the first place. However busy we are, and lesson time is always too short, we ideally want to find a little bit of time to observe our students, to listen to their sound, and to encourage their awareness. It of course makes sense for all teachers to try and learn as much as possible about injury prevention. But however hard we try, we can't guard against every eventuality. And sometimes students become injured and it can feel very challenging for the teacher. It's very normal in those circumstances to refer the student to a more experienced colleague for a few sessions. This injury specialist will be able to give you some advice and then refer the student back to you to continue the exercises they've suggested. You might like to ask if you can sit in on the lesson so that you can work out a recovery plan all together. And if you can't do that, ask the student to make some notes during the lesson for you. In The Complete Pianist, I demonstrate how the exercises I've shown you already can be adapted for pianists of all different levels. And I firmly believe that actually the foundations of technique can be taught within the first few years of study. So I'm currently preparing 3 technique books for the beginning stages, which I hope will be a useful resource for piano teachers. I also offer online courses for teachers on teaching healthy piano technique. Details are on my website. In our multidisciplinary clinic at BAPAM, we are fortunate to be able to combine the medical skills of a hand surgeon with my own technical retraining skills. We learn a lot from each other, and we're able to create a joint recovery plan with the pianist. We're hoping before too long to be able to also include some physical therapists within each clinic. The feedback so far has been extremely positive, and Mark Phillips, the surgeon, BAPAM and myself are very happy to share our experiences with other organisations in the hope that other organisations may be interested in creating a similar clinic. We are giving a talk at the PAMA conference this summer, and we're also doing a free online workshop for BAPAM and the Royal Society of Musicians in June. You can find out more about this online workshop and also about other resources on healthy piano playing from the following links.